isolation for the entirety of their infectious period. I think 41 of those 44 are day 13 tests, so it's the system working exactly as it should. We thank the many tens of thousands of people who are currently tucked away, no risk to public health, doing their ISO, doing it diligently. We're supporting them as best we can, but it's a really big contribution that they make. For those who have tested positive on their day 13 test, many of those 44 that we're talking about today, who are in isolation, they will in fact have to restart their isolation. They'll be in isolation for some of them for as many as a full 2 weeks. So we do thank them in advance of that work. It's the best of work on behalf of all of us. But these numbers, I know 54 seems a very big number, but 57, seems a very big number, but when the vast majority of those have been in isolation for their infectious period, that's exactly what we want. That's exactly the system working as it should work. And it goes to that point we've made a number of times that the numbers, yes, they're important, but the story that sits behind those numbers is in fact more important than the numbers alone. So again, we thank all of those who are in ISO, and we thank those who will have to do a longer isolation period because the day 13 test has shown that they have coronavirus. Jerome can speak in more detail to the breakdown of where those day 13 tests have come from. I would just say that as you move through the outbreak and its different stages, these are principally Altaqua students and close contacts, close personal contacts from that school outbreak. There'll be other parts of this that unfold over coming days, so we may see further cases that are exactly the same as a result of day 13 testing. There are some 296 active cases across the state. 16 people are in hospital. 3 of those are in ICU, and I'm told 1 of those is on a ventilator. There were just under 50,000 test results received overnight, so that's 49,607 tests, and we thank each of those people. That's a significant uplift from some of the numbers that were a bit low only a few days ago. We called for people to come forward, particularly in that inner south area, and we've seen very strong numbers of people coming forward to get tested in that part of Melbourne and indeed right across the whole state. If you've got any symptoms whatsoever, please come forward and get tested. It's such an important thing, a powerful thing that you can do to protect your family and indeed to help us protect every single family right across the state. That's where we want to see those numbers as close to that 50,000 number and even higher if they need to be, based on people and symptoms. We want everyone to act on those symptoms as soon as you register them and come along and get tested. I just again make the point that 99.1% of results are received the day after you have the test taken. So the turnaround time is still very quick. The queues are not that long, and it's such an important thing for you to do to help all of us defeat this thing. Get tested as soon as you register any symptoms. And if there's a family member who you think has got symptoms, then you need to prompt them to go and get tested as soon as you register that they have symptoms. If we all do this, if we all play our part, then we'll have more tests and we'll have a clearer picture of where this virus is and a clearer picture of where it isn't. And that helps us make the best decisions for restrictions and rules, and it helps our contact tracers do all their important detective work as quick as possible. Now, in terms of jabs, yesterday was a big day for vaccinations, 27,581 Victorians were vaccinated yesterday. That's in our state hubs. It takes us to 2,050,042, so over the 2 million mark, of doses administered in our state-run centres. That's something that all the staff who are doing that work can be very proud of, and of course the vaccination program exists beyond state-run centres. It's in GP clinics, it's in some pharmacies, it'll be in even more pharmacies quite soon, and we thank everybody who's involved in that, particularly those who've come forward to get vaccinated. Now, a couple of quick things further on vaccinations. I've got a couple of announcements to make. We said, you would all recall, just a week or so ago, we opened, we think, the country's first drive-through vaccination hub out at Melton. There's been some 1,200 doses that have been administered over the last week at that drive-through site at that old Bunnings store in Melton. We've indicated that we'd have 3 more drive-through centres that take it to a total of 4. They are as follows: the Eagle Stadium in Werribee, that'll be both drive-through as well as indoor vaccine program. That'll be opening up over the next week or so. We'll update you when we've got a clearer picture of exactly the day that will open, but there's a lot of work to get that stood up, and that's happening soon. In terms of the old Ford factory in Broadmeadows, that's a drive-through site, and that is being expanded to include a drive-through site, and it will be open for booked appointments from Monday the 23rd of August. And finally, the third of those three, Sandown Racecourse out in the southeast. That's an existing site, but we'll expand it to include a drive-through, as well as that indoor vaccination hub, and that will be open to the public for booked appointments from Saturday, the 21st of August. So off the success of the, if you like, the test drive-through out in Melton, there's three more of those that we can open progressively, Saturday, Monday, and then we'll come back to you on the Wyndham site in due course. Just a little bit more work to be done to finalise the exact day when that will be open. Speaking of appointments, just my final point before I ask Ben to speak to some other matters, and then Jerome can take us through individual cases and that sort of outbreak map, and Shane's here as well, Chief Commissioner, to speak to any enforcement issues. Just on appointments, I know that we've all spoken for a long time about the fact that we wish we had more vaccine and we could vaccinate everybody, as fast as possible. And that supply has been a real challenge, but we are seeing more and more supply become available to us. We announced some 300,000 additional appointments last weekend and the weekend before. So there are appointments out there available right now. So to give those at home watching and listening a sense, at the old Ford factory, there are 2,869 appointments during the next week. So there are appointments over the coming 7 days that don't have names beside them. They are available, they are free. If you go online, you can book one of those appointments right now. At Bendigo Health, there are 2,545 empty appointments, free appointments, appointments that you can take one of. Plenty Ranges Arts and Convention Centre at South Morang, 2,247. The Melton Indoor Vaccination Centre at Woodgrove, 1,640 appointments that are open, available to people who book them. Sandown Racecourse, similarly 1,046, and the Melbourne Showgrounds 1,042. They're not the only ones that are available. That's just a sample of some well-known locations. In aggregate, over the next week, we have some 26,000 bookings that are free as I stand here right now, and the split is 14,000 Pfizer and 12,000 AstraZeneca. So there are appointments there, they're ready, the teams are ready to put a jab in your arm. You just need to book, and you can book with confidence. There are spots, and progressively as we get closer to September and well through September, when Moderna starts to arrive, when more and more Pfizer starts to arrive, we'll be able to speak about many more appointments than this. But that's not a reason to delay. This is available now. Get online, book an appointment, turn up, and you will be processed as fast as possible, and you will have played a really powerful part in keeping yourself safe, your family safe, and indeed every single Victorian safe. This is our way out in the long term, so I would commend people to get online, make a booking, and there are literally thousands of appointments available in just the next week and over the next 5 weeks as we look to get 1 million jabs in 1 million arms. That was all I had to update people on, and now I might ask Ben to speak to some of the public health matters, then Jerome, then Shane, and then we're happy to take any questions you have.
Thank you very much, Premier. So to paraphrase Brett Sutton, I think the best vaccine appointment you can make is one that you make today. So we really hope people get online, just echoing the Premier's words there, get online, make an appointment and start your journey beyond into the sort of COVID normal area that we're all hoping to get to. So just reflecting on the utility or the benefit of these vaccines, the public health team have been analysing the vaccination status of the 529 locally acquired cases from the 12th of July through to the 18th of August. And of these 529 individuals, 80 were eligible to be vaccinated but hadn't been vaccinated at the time that they were infected. 45 had received one dose of their vaccination, and 23 or slightly under 5% were fully vaccinated at the time they were diagnosed with COVID-19. Of the 14 cases that the Premier referred to currently in hospital, 5 were not eligible for vaccination, 9 were eligible for vaccination but hadn't received it, and none were either partially or completely vaccinated. So we've reflected previously that both the Pfizer and AstraZeneca vaccines do prevent infection, and they do prevent transmission to others if you do happen to be infected. They reduce your potential to infect others. But the really critical point here, both AstraZeneca and Pfizer vaccine are around 90% protection against serious illness, against hospitalisation, and against loss of life. And that's for the Delta variant. So these vaccines are so critical. So please do make that appointment and go and get vaccinated as soon as you're eligible. So I'd like to turn to discuss another really important tool we have in the response to COVID-19, which is wastewater detection and surveillance of wastewater. So we're continuing to see a number of what we call unexpected detections of COVID-19 in the wastewater system. So while the testing program isn't necessarily a smoking gun, it does provide a really good signal and another line of intelligence for us to follow. So we began targeted wastewater surveillance in high-rise public housing towers, and then received a detection at a complex at 480 Lygon Street in Carlton several days ago. Based on that signal alone, we made the entire complex effectively a Tier 2 exposure site and encouraged all the residents to get tested. And we uncovered a case living inside the building and were able to provide them care and treatment and to prevent other transmissions, sort of highlighting the potential use of wastewater detection as an advanced warning system. Sometimes the detections are the result of someone who is shedding after they're no longer infectious. So someone who's had COVID-19, have cleared it, but we still continue to detect fragments of the virus in the wastewater. Sometimes it's from a case we know about, who's isolating and safely being monitored and contributing, as the Premier was saying, to keeping us all safe. And so that explains some of those detections. But when we don't know of any cases isolating in an area, that's when we call it an unexpected detection, and that's when we really pay close attention. So we have a few of these signals alerting us right now. In regional Victoria, we've seen 3 repeat detections in Shepparton, with our period of concern being between the 9th and the 16th of August. And I know the community in Shepparton has come out. Testing numbers have increased substantially over the last few days, but we can do more. So with the slightest of symptoms or any concerns, please come forward to be tested. We've also seen a detection in Lakes Entrance with a period of concern between the 8th and the 11th of August, although we haven't seen a repeat detection in Lakes Entrance. Here in Melbourne, we've seen continuing repeat detections in Ardia with a period of concern between the 11th and the 16th of August. And we have new detections reported in the suburbs of Albion, Braybrook, St Albans, Sunshine, Sunshine North, Sunshine West and Tottenham, with a period of concern being the 15th to the 17th of August. And we've had 3 detections in some southeastern suburbs, including Dingley Village, Keysborough, Noble Park, Springvale and Springvale South, with a period of concern being between the 11th and the 17th of August. Possibly of greatest concern to us at the moment is the strong repeat detections we've identified and reported regularly in an industrial precinct in Sunshine West. Now, that's an area where nobody resides, there's no one living there, but a lot of people work there. So the period of concern is between the 8th and the 17th of August. It's actually situated in quite a tight, small, geographically contained area. So between the Western Ring Road on the western side, the Glengala Drain to the north, Cororoit Creek to the east, and Industrial and Proximity Drive on the southern margin. And if you Google Vic Wastewater, you'll be able to check out the map for yourself. So we've been working with businesses in this precinct on surveillance testing for the last few days, and we haven't uncovered any cases at this point. But essentially we're at the point where, based on these repeat strong detections, it becomes more likely than not that someone who works in this area actually does have coronavirus infection, and that is clearly of concern to get them tested so we can look after them and provide them appropriate treatment and care, but to protect their colleagues and indeed the entire community. So my message is that if you work in that industrial precinct, come forward to be tested now, even if you don't have symptoms. And finally, thanks to all the many people who work tirelessly to both detect and respond to these wastewater detections. The 17 water utilities play such an important role, and we wouldn't have access to this information without their cooperation, support and really hard work. Because wastewater really is an early warning system, and particularly for the Delta variant of COVID-19, an extra day's warning is something we can really use. It's really precious. I'd like to hand over to Jerome to take us through the cases now. Thanks.
Thank you, Ben, and good morning. So 57 new cases of coronavirus in our community outbreaks today. That takes us to 296 active cases of COVID in Victoria. One of those is in hotel quarantine, 295 remaining active cases around our community outbreak. We've got around 12,000 primary close contacts and over 550 exposure sites. As the Premier said, the 57 number of this morning, and I apologise for spoiling anybody's breakfast when they saw that number this morning, does break down into three quite coherent groups. 44 of those have been in full isolation and have really come up through our day 13 testing. I'll go through that in a moment. We have 10 that have come through our contact tracing efforts with recent cases we've identified in recent days, so they are associated with those cases that we're working on at this point in time. 3 are genuine mystery cases where we're following a number of leads. In terms of the 44, 38 of those 44 are associated with students and households at Altaqua College. And this group of people have been doing a huge amount of work over the last 2 weeks in isolating so well and so strongly. And my thanks to the whole school leadership and community leadership for enabling these families to do that so well. But it does mean that for these 38 people, they will have to continue with another 2 weeks of isolation, and they'll be supported by ourselves and the school community to do so. And my thanks to them for stepping up on the next stage of that long journey. We also have 3 more cases associated with Glenroy West Primary School, again day 13 tests. 1 case associated with Caroline Springs Square Shopping Centre, 1 with the Newport Footy Club, and another with the Newport community case. So those 44 were all in full isolation for their infectious periods. In terms of the next batch of 10, 1 is associated with a close contact at 510 Lygon Street, a positive case we identified yesterday, and they'll be going into hotel quarantine today. We have 3 associated with the St Kilda East community gatherings that we've been investigating. We have 3 various household contacts of positive cases we've identified recently. They are connected, but they're not linked to each other. And then 3 associated with the Central Park pizza shop in Malvern East. So 3 close contacts associated with the teenage pizza worker we discussed yesterday. So that is those 10, all understood contacts, all understood linkages, and they'll be partly through their infectious period. We have 3 new cases, mystery cases, we're investigating today. 1 of those is in Glenroy. We have a number of potential leads. I'm fairly confident we'll land that fairly quickly. We have one case in Ascot Vale that's got some geographic proximity to 2 other cases that we've seen in that area, but we have no obvious links at this point in time. And we've got one in Doncaster, no obvious links there, but some more investigations going on around that particular case. That's 57 cases in total for today. Yesterday we talked about the major clusters that we have around this outbreak. The standing of those at this point in time is we have 8 cases associated with West Footscray, again right at the beginning, 2 weeks ago. That outbreak looks very stable. We've not seen any new cases there for a while. We have 2 cases associated with a delivery driver around Wyndham. Again, that's been stable for a number of days. We have 3 cases associated with people in the City of Melbourne, 3 linked cases in the City of Melbourne. Again, that's been stable for about a week. We then have a cluster of 7 cases around 480 and 510 Lygon Street. That's an increase of 1 on today. Ongoing investigative work and a lot of testing happening, particularly at 510 Lygon Street. And my thanks to the whole community of those Carlton Towers for their fantastic support in coming forward and getting tested and in isolating a combination of Tier 2 and Tier 1 status around those buildings. We have 255 cases associated with our large cluster from Newport to Caroline Springs through the schools up into Glenroy. That 255 figure is now an increase of 44 on yesterday, but that is largely, in fact that is entirely those day 13 tests coming through into that particular catchment. We then have 18 cases now scattered around the St Kilda area. That is an increase of 3 on yesterday. Some of those are connected, such as the St Kilda East cluster. Some of those are still unconnected, and we're continuing to do a lot of work in that area. And we now have 4 cases in the Malvern area around the pizza shop. At the moment, we're now not connecting that with the wider St Kilda East cluster. We're exploring some other potential linkages over the course of today. There are 12 other smaller cases that are under investigation. They're all pretty stable. It includes 6 from today and 6 from earlier stages of our investigation. So we can see that the shape of the outbreak continues to be one very large cluster around Newport, Caroline Springs, Melton, into Glenroy. That is a dominant share of our cases, and a number of other subclusters where we're still trying to work out the linkages back to the main cluster. Genomically, everything remains connected to the southwest Sydney clusters and everything else we're seeing here in Melbourne at this point in time. Can I now stress, yesterday we cleared 3,000 primary close contacts from day 13 testing, and we've discussed this a number of times recently, but this really highlights the importance of that isolation protocol. 3,000 people came through yesterday, completed their day 13 test, and were formally released by the department. It also puts into context the 41 odd cases that we've identified as positive tests today out of that day 13 testing. So firstly, my thanks to the 3,000 people for completing their isolation process and for doing those really hard yards for those 2 weeks. That is such an important part, and particularly when you identify a significant proportion of cases, the 41 today, that are those positive cases that we need to do further isolation on. It shows how important that is in controlling this outbreak. We are, of course, seeing a good uptake in testing, just under 50,000 test results for today. Again, we're seeing some good pressure on the testing system this morning. My thanks to everybody who's coming out to go and get tested to help us put the remaining pieces of the puzzle together so we can wrap up these outbreaks. Well, clearly a lot more work to do. Very strong testing across St Kilda yesterday, 1,700 tests across multiple different testing stations, including some of our vulnerable settings and some of our dedicated community hubs. And a huge shout out and thanks to the community workers, the community leaders in the wider St Kilda area for their support over the last few days. We need to continue that support as we work to make sure that people are supported to isolate and to do the right things, and we continue to do the investigative work to find out any remaining links. In terms of our focus really for today, we will continue to obviously look at the inner south corner, a lot more detective work to do around there and into the Malvern area. I am concerned about Doncaster, so although we have a number of primary close contacts there, I'd encourage anybody in the Doncaster area who doesn't feel well to pay particular attention and go and get tested today. We've also continued to see a number of grumbling cases in Altona North. We think we understand the linkages between them quite well, but I am a bit concerned that we're still seeing such activity, and I'd encourage anybody in the Altona North area, Hoppers Crossing area, who isn't feeling particularly flash, please go and get tested today. Let's help us close out those remaining linkages on this particular outbreak. Finally, before I hand over to the Chief Commissioner, we're aware of a positive case in New South Wales in the Broken Hill, Wilcarnia area. We're working very closely with the Sunraysia and Mildura community, both community health and our health services in that part of the state. There's a number of very important communities on both sides of the Murray in that part of our state, and we are keen to ensure that anybody who has recently been in the Broken Hill area or in the Wilcarnie area, if you're now in Victoria, please come and get tested. It's really important, if you've got any concerns about having been particularly in the Wilcarnie area, that you come forward and get tested. If you've got any symptoms, of course, please come and get tested, and we'll continue to work with community leaders in that part of our state over the coming days. With that, I'll hand to the Chief Commissioner. Thank you.
Thanks, Jerome. Just a very brief update on what Victoria Police is doing to support the compliance with the Chief Health Officer guidelines. As you would be aware, we still have significant resources up on the border. We still have the Metro Rural Divide where we're enforcing there. We have our Sentinel patrols, which have always been the case, randomly out there in public and responding to calls. We're also obviously in the hotel quarantine program. In addition to that, we spoke the other day of Operation Shielding and how we'd be relaunching that. That has occurred. We now have over 200 protective services officers and police officers deployed on a 24/7 basis. They are being deployed to public spaces, shopping centres and areas where people are congregating. They're making sure that people are complying with the Chief Health Officer guidelines. Over the past 24 hours, we've checked over 6,500 people, so significant work by those officers out there doing a great job. In addition to that, we've seen between 50 and 60 infringements given out for a range of matters right across the state. Generally, the bulk of those would be, there were 13 for curfew breaches, 12 for private gatherings that shouldn't have been occurring, and 11 for mask offences. So they make up the bulk of those, and obviously with our data it doesn't settle, so I can't give you exact figures at this time, but that's a general sort of guide as to what's happening. In respect to what's been known as the Engagement Party investigation that we're conducting that occurred in Caulfield North, the parties involved in that have been very cooperative with police into our investigation. That investigation is still ongoing. It's obviously hampered to a degree by the fact that they're in isolation, those persons, but we have to this stage issued 4 infringements at this time. 2 of those have been to the parents of the bride-to-be, and 2 of those have been to the engaged couple as well. As I say, these parties have been cooperative with us. We are now in the throes of arranging to engage with all of other persons present and how we can conduct those interviews through Zoom and other areas to ensure that we have proper identification. So that investigation pretty much remains ongoing, and that is in effect what we're doing. It's continued enforcement from us out there. It's continuing to work with the community. It's continuing to make sure that people are adhering to the Chief Health Officer guidelines. I'm happy to take questions or pass to whoever here is.
Pass back to me then. Happy to take any questions you have.
Premier, do you have an update on the playground transmission yet?
No, I don't have an update on that, and I'll just make some points about playgrounds because people are very interested in those matters. I know it's tough for families to not be able to take kids to playgrounds, but we've got 50 kids, 50, perhaps more now, as part of this outbreak that have got coronavirus. This is kids that have got this virus. So any sense that children don't get it, or any sense that children don't get it and don't spread it, is just wrong. We've got that many kids and perhaps more now, and maybe we'll see more over the course of this. We've seen some evidence of outdoor transmission. We've seen evidence of transmission between people that don't even know each other and don't know that they were in the company of each other. This thing moves rapidly, and we're about trying to stop any more transmission. We're about trying to stop any more kids getting this. I know and understand it's difficult, but I would just make the point, I've had feedback from lots of parents who tell me how hard it is. Yep, I get that, I understand that. But I've also had feedback from lots of parents who say, well, look, you know, with so many kids with this and with the virus in our community and the fact that there is community transmission, that they don't want to take their kids to the local park, the local playground. I've had others who desperately want to do that. I've also had a number of people send me photos of what some playgrounds looked like last week. and they didn't really look like playgrounds. They looked like places where there were hundreds and hundreds of people. This is tough, I know and understand that. But the best thing we can all do is stick together, find a way to get through these next few weeks and hopefully drive these numbers down so low that kids can be back at playgrounds and kids can be back at school and we can all be doing things differently. These are not indefinite measures. And I've never said, no one has ever said that any one measure is like a magic wand with this. It is a package of measures. And it took us from more than 700 cases a day last year to 0, and it will work again. That's not just my view or what the logic and what the history of our state tells you. It's what the Chief Health Officer has pored over very, very carefully and provided up to the government in advice. And I make no apology for following the advice of the Chief Health Officer.
Premier, a lot of Victorians would be concerned in the spike in today's case numbers. It's quite a significant increase, but the fact that majority were in isolation.
Very, very good news.
So, yeah, the figure isn't as alarming as we should believe it to be.
Look, we don't want to see, and we never want to stand here and look like we're happy that there are extra cases. No one wants to get this because it can be very, very challenging, and people can become ill at any stage of this virus. People can have long-term effects. It's not good to get this. But whilst when people woke up this morning and saw tweets and other media reporting 57 cases, they might have thought, well, that's a bad day. The key point here is that the vast, vast majority of those people were in isolation for 100% of their infectious period. Around the 13th, 14th, 15th days of one of these outbreaks, you do see a spike because we do that day 13 testing. And there's a reason we do the day 13 testing, is because people can turn positive very late, a number of days after they've first been exposed. The other thing too is that just because of the makeup of this outbreak, there's a number of large families, so it doesn't take too many transmission events to have quite a large number of people, because the families are quite big. But to those families, we say thank you. To everybody who's in ISO, we say thank you. And these numbers just makes the point we've, I think, tried to make a number of times for 18 months now. Numbers are very important, but even more so, the stories that sit behind those numbers. Every case is a challenge, but if it's a case who's been in isolation for their entire infectious period, then that's the system working as it should. We thank them and we thank our contact tracers for having found that original case that then isolates all of their close contacts. Pardon me.
Of those 41 cases that tested positive on day 13,
yes.
Had all of them received a day 1 test?
Yes, I believe when it comes to things like El Taco, we had 100%. So people had been tested, they'd done an amazing job. These are people who had tested negative originally and have become positive. That's why day 13 testing is so important. You can't just rely on a test that was taken literally a fortnight ago. People are in ISO. We've moved people out where it wasn't safe for them, and Delta's such that it really can't do the one person at one end of the house and 7 other people at the other end of the house type of thing. We've done a heap of that. Just goes to show you can have this and have it for quite some period of time before you would test positive with it. And we know that before you get symptoms and before you test positive, you will have been infectious. So that's why them being tucked away is so important. Not easy for them, like really hard to not leave the house at all, but they've done a fantastic job.
Is there a possibility that they could have been actually positive on day 2 or day 3 of their isolation, and therefore they may have had close contacts before they went into 14-day quarantine?
But what we're reporting, though, just to be clear, that those people have been in isolation for 100% of their infectious period. Now, that isn't the case with every case every day. There are some people who will have been in ISO for all their infectious periods. Some people will have been in ISO for the majority of their infectious period. Some people will have not been in ISO for their infectious period. They're the ones that really worry us. But the reason why these numbers are not quite as concerning as they might look if you just looked at the raw number is that the vast majority of these people, 44 of them, have been in isolation. Another 10 are linked to outbreaks. There are 3, so we know about them. There are 3, however, that we're still doing that coronavirus detective work. They could be mysteries. We just have to wait and see.
Of those 44, Premier, of those 44, they're connected to Al Taqwa and Glenroy School.
Yep.
Do we know how many are actually children? And is that a concern?
I can come back to you. I don't have that breakdown right now, unless somebody else does. We don't have it. No, we'll try and find it for you, though.
Have you thought about
There will be. It just stands to reason that there will be.
Is that then a concern that this in this outbreak there are so many children.
Well, there certainly are. Like as Jerome has reported, as Brett's reported, I think Ben as well has reported, we've got 25-30% of cases out of this outbreak are kids. And when I say kids, like under 10. If you go out to the teenagers, the number grows even further. I think we went through the numbers the other day. It was 75 young people, children and young people. So, look, I don't think all this time on, 18 months on, I don't think too many people were of a view that kids can't get this. I think it's clear they can. They can also spread it. And that's why the Chief Health Officers had to make some really difficult decisions and provide advice to us that it's not easy to... Those messages are very hard to deliver. They're not easy decisions to make. But he's done the right thing to protect our children. And now's not the time to be at playgrounds. I'm sorry about that. I wish it was different. I'm working as hard as I can, and so, from the Chief Commissioner's report, so too are the vast majority of Victorians who are obeying the rules to get us out of this, to get the playgrounds open, to get the schools open, for heaven's sake. That's what we want.
Have you thought about mandating more tests for people in isolation, say on day 6, day 7, day 8?
If people become symptomatic, then we can test them, and we do. The day 13 protocol is really important. Anyone who wants a test before then, if they wanted certainty, then we're always happy to do that. I don't think there's any need to change that. I think it's important that at the beginning you get as many people as possible that are in ISO tested. We've done that, and we thank the Altako community and so many other communities, so many other families who've been, while we've all been doing these media conferences, they've been literally not setting foot outside their house, which is not easy, but it's absolutely critical. If we don't have that, then the virus spreads even further.
As happy as we can be about these 44, there's still 13 who were infectious in the community, 3 mystery cases, and we went into lockdown for 1 mystery case. We're 200 days into lockdown now, and the reality is Victorians are facing many more. Is that accurate?
Well, I just extended the lockdown by 2 weeks, and it was supposed to expire at midnight tonight. So yes, we've got at least 2 more weeks to go, and this is a tough fight. And if I had a different option, if the Chief Health Officer had a different option, if the premiers and chief ministers of every state in our nation, if the Prime Minister of our nation had a different option, a different lever to pull, then we would do that. We simply don't. Delta is either you have lockdowns and a very small number of cases, and hopefully you keep driving those down, or you have what New South Wales is dealing with at the moment. And it's very, very difficult. It's very difficult, and if you were to take off the restrictions that we have now, we'd become Sydney really, really quickly. And if Sydney lifted all their restrictions, New South Wales I should say, if they lifted all their restrictions, well then their hospitals would literally be full in a matter of days. And I have, this is an important part of my job, I took the time to speak to many, many nurses and AMBOs last year when we had similar numbers of patients in our hospitals. And I don't think any of us can really understand. If you weren't one of those patients or a family member or a member of staff caring for them, I don't think we'll ever really understand just how challenging it is, just how tough it is to have even 500 people in hospital, let alone 5,000. So that's what we have to guard against. Lockdowns are very painful, they come at a cost, but they work, and the benefits outweigh those costs, as hard as it is to sometimes rationalise that when you're in the middle of one of these lockdowns. These numbers are better today, but they have to be better still. You're absolutely right to say that. We have to drive them down further.
Why are we 1 million or so vaccines behind New South Wales when you account for the state hubs, the GP clinics, pharmacies? We're 1 million behind, and they're in their situation, and they could reach 80%, possibly even open up before we have a chance to. Why are we so far behind, and how do we increase our pace even more?
A couple of points. Firstly, they might have received a bit more supply than us, so that might perhaps be an answer for some of it. The other point too is that we do know that outbreaks drive people's take-up when you're in the sort of situation they're in, and that is a prompt, and you do see people come forward in greater numbers to get vaccinated, and we've seen that too. We haven't seen it to that extent because we don't have the cases that they have. Beyond that though, I would say that our state clinics have done a mighty job, and they continue to. I can thank GPs, I can thank pharmacists, but I can't speak to the take-up rate. That's a matter that only the Commonwealth can speak to. Again, we are playing our part, and we are doing more than our fair share, but we'll do more still. But as far as anything that's going on in GP land or pharmacists, then you'd need to speak to the federal
Have you
government.
thought
on
about
that,
just on
And I
that
think
point?
if you compare our state effort to New South Wales and every other state, we compare very, very favourably. We might not be administering quite as many doses on a per capita basis in primary care. I'm not in charge of primary care. I've got great relationships with the college and with the AMA and with the Pharmacy Guild, but I don't pay their bills, and they don't look to me for the provision of vaccines. I'm accountable for the state sites, and we're pushing as hard as we can there, and that's why, you know, there's 26,000 appointments. If I'm not referring to 26,000 appointments, I think I spoke about in the next week. 14,000 Pfizer, 12,000 AstraZeneca. If you go online right now, as this press conference right now, you can book one of those appointments close to home with certainty, and you can get vaccinated.
Have you thought about opening up some of those appointments to year 11s or 12s?
I've got no announcements to make about additional cohorts at this point. We have appointments that are not filled at the moment for the current people who are eligible. Pfizer is eligible from 18 to 39. AstraZeneca is eligible from 18 to 39. We made those announcements just a couple of weeks ago, and we've seen really significant take-up of that. There are many, many people who are eligible. I'd encourage them to go and get online, get one of those appointments, go and get vaccinated. We'll get you through the system as fast as possible, safely, and then you will be one dose closer to 2 doses and being fully vaccinated and helping to contribute to the 80% we need to get to so that we can open up.
The New South Wales Premier apparently said in her press conference today that by the end of the month, they hope to get a level with vaccinations where she'll look seriously at easing restrictions for those who have been vaccinated. Do you have any idea at this stage when Victoria can get to that level, and would you contemplate also doing the same?
Well, I'll just make a couple of points in relation to that. Let's see where we get to at the end of this month, the end of next month. You know, we've got, from a vaccine point of view, we've got certain volumes of vaccine have been promised to us. We haven't seen those yet. Let's just wait and see that they arrive. The appointments I'm talking about today, though, and the 1 million vaccinations we want to do over these next 4 weeks, that's on stock we've already got. We can be certain. People can book with absolute certainty around that. In terms of our total performance in coming weeks and months, that'll be dependent on how much supply is here and how many people come forward and access that. I'm very confident that people will access it strongly. I think this notion of hesitancy, that's sometimes us talking amongst ourselves a bit. I think there's a lot of people out there, millions in fact, who want to be vaccinated really fast. On the issue of rules, I think it is important to very precisely note the Premier of New South Wales language. She's not talking about opening up and ending a lockdown. She's talking about perhaps some changes to the rules. I don't know what that looks like from her point of view, but I know it had been interpreted as that all the rules would come off and they'd be open at 50% or something like that. I don't think that's what she's talking about at all. She's talking about potentially easing some rules. We would always look to ease rules as well. I want less rules, not more. I want this to be over, and the only way it can be is if we get cases down and vaccination up. That's what we're working towards.
Case numbers in New South Wales are still growing. Do you think even if New South Wales did ease some of their restrictions, it would be able to? Don't you think it'd further drive up cases given the infectivity of Delta and not 100% of the population would be vaccinated?
As I did the other day, I don't spend a lot of time thinking about what's happening in New South Wales. We've got our own challenges to deal with, but what I know and what the facts tell you, because I've read the report, I was in the meeting when it was provided, the Doherty modelling is not predicated on 5,000 or 10,000 cases and 600, 700, 800, 1,000 cases a day. It's predicated on very few cases. So the assumptions that CSB able to manage demand in the health system at 70% vaccination and at 80%, that's not based on an outbreak that's running wild. It's very different. That's why we're working so hard to not get to that point, because that means that the modelling that says 70 will work and 80 will work, so that is be open and be in a very different world by the end of this year, I think it gets harder to do that if you've got cases running wild. You've got to go into those eased restrictions, that new set of rules with as few cases as possible. And I've been criticised for this, but I think we will get, and the National Plan speaks to some rules that will apply to people who are vaccinated and some different rules that will apply to people who aren't.
Would you be comfortable with?
And then the exact detail of that's not yet settled. And to be clear, when we don't have enough supply to vaccinate everybody who wants to get vaccinated, it's too early for us to be telling people, what it's going to be like. and how they're going to be, they're going to be having less freedom if they're not vaccinated. Once we've got supply here, though, then it's probably a little bit more appropriate to be having some of those discussions.
Given we share a border with New South Wales and the level of travel between the states, would you actually personally be comfortable with any type of restrictions being eased, given that you've been calling for, tightening of restrictions in New South Wales to contain that outbreak?
It's not about what I would be comfortable with personally.
But that has an impact on Victoria.
No, let me finish. The border is shut, except for compassionate reasons and a small number of I think would be broadly agreed, essential workers, authorised workers, whatever term you want to use. So freight, for instance, or people that might live in the bubble and travel into Victoria to staff the hospital at Wang, or people in Wangaratta who go and staff the hospital in Albury, which we actually run, things like that. But the notion of free movement between New South Wales and Victoria, that is not permitted now, and it won't be permitted unless and until it's safe. Unless and until the New South Wales government, the Chief Health Officer, looks at what's happening in New South Wales, what's happening in Victoria, and provides advice to ease that.
But epidemiologists are already indicating that case numbers will climb into the thousands. So aren't you concerned at all that will jump across the border? Is there anything else we can do?
What I'm trying to say to you is I'm not here to be a commentator on New South Wales as much as you might like me to, and as much as I might have views on things. That's not my business. We didn't like it last year at all as a state when people, behaved pretty appallingly in relation to the challenges that we were facing. I don't want to make what Sydney and New South Wales is going through any worse by providing gratuitous commentary. I said a few things when I felt I needed to. I've got nothing to add to that today, other than to reassure all Victorians that we will make the decisions, however tough they are, to keep our state safe.
But our outbreaks
the notion of
from
freedom of movement between the two states ain't happening anytime soon, because it just wouldn't be safe to do that. Now, I appreciate, having grown up not far from that border, like my mum is only 45 minutes from that border, it's very challenging for border communities to not have all the freedom of movement that is a normal part of their life. The border doesn't exist for so many of those communities. They shop and work and get healthcare and get educated and do all of, and have social, community sport, all sorts of different things. We know that there are impacts there, and that's why we'll very soon announce some further business support. It'll be for the whole state, and particularly for those in metropolitan Melbourne who are most affected by these most recent extensions. And that's, again, a strong partnership between our government and the Commonwealth Government, but I'll leave it to the respective treasurers and industry ministers to announce that, but it'll be a very significant amount of additional funding.
Has the New South Wales Premier indicated that?
We monitor that almost every day, Nick, and if we saw, so for instance, we had a bit of a scare about a case in Wentworth the other day, that meant we looked at all sorts of things. There's this Broken Hill case. If we started to see seeding further south right into southern New South Wales, then it's every chance that we would look to go even further. And those border communities, as much as it's difficult to live under these conditions, the last thing you want is this virus getting into those regional communities. The last thing you want is more and more incursions, more virus from Sydney and New South Wales, because that'll make our challenge of driving down cases even harder.
What more can you do?
Well, there are always options, Nick. There are always options. Those who are authorised to enter, that list can change. Those who've got permits, the reasons that you can move within that border bubble can change. The local government areas that make up the border bubble can change. It just says 4 local government areas on the New South Wales side were in fact removed from that border bubble only a couple of weeks ago, I think.
Has the New South Wales Premier indicated that aggressive suppression is still the strategy that they're pursuing?
That's the National Cabinet agreed strategy. That is the National Cabinet agreed strategy, and again, I just make the point, and maybe that's the best way to make the point. That's the National Cabinet strategy, and that's the assumption, that's the starting point that Doherty has used to work out whether it's possible to start easing at 70% and then ease even further at 80% and not have your hospitals overrun. So there's no choice but to do what we're doing now, and that's not just my view or the view of one side of politics. That's every leader of every government in our nation sitting around the National Cabinet table.
Then what do you make of the comments that all Australian states have to learn to live with the Delta variant?
I'm not here to be a translator for the New South Wales Premier or an interpreter or a commentator. What I'll say is that Delta's here to stay, and the way out of this in the short term is, I'm sad to say, lockdowns. That's in the short term, although I think Sydney's might be a much longer term thing. That's just where they're at. The long-term way out of this is to get vaccinated, and that's why, as I said before, there's 26,000 appointments. Go and book one right now. Hopefully when I'm next before you, tomorrow or the day after or the day after that, I can report that all those appointments are gone and the next lot are open. You know, there is a clear way, a clear thing for people to do, and that is, if eligible, go and book one of those appointments.
Just with regards to vaccination, the 175 that we received from Poland, do we have any indication on how they'll be distributed throughout the state?
We don't get ours till next week. So
do you know which groups you'll target or which areas?
We're looking at that very closely, and we'll have further announcements to make. So people with plenty of time, people will know what we have, where it'll be administered and who will be eligible to get it.
A staff member from the Glenroy York Street kindergarten is refusing to get tested. That means they're being treated as a positive case, and dozens of kids and people who work there are in isolation. How frustrating is that we're seeing people refusing to get tested?
I would refrain from commenting on a specific case I'm not briefed on, but I would just say all of us have been asked to do so much over the last 18 months. Submitting for a test is the least you can do, I think. Seriously, so many Victorians have given, millions and millions of Victorians have given so much. If you're asked to test because there's a sense you may have the virus and we want to rule you out or provide you with care and support, but also look after the safety of people you've been with, some of whom might be little kids, I don't know that that's such a big ask, is it? When you think about all that people have given, all that people have done in our state, more than any state. Again, I'm not briefed on the specifics of that case, but the good news is the testing numbers are up. So let's not focus potentially on people who won't get a test. I'm really pleased to see after a few days of us saying, look, more people have to come forward, particularly in that inner south region where we've had those mystery cases, we've seen numbers back up close to 50,000. We've got to keep that going, even on the weekend. If you get symptoms any day, doesn't matter when it is, you've got to act on those symptoms and go and get tested as fast as possible.
Premier, are you aware of positive cases at a vaccination clinic or at the Prahran Town Hall testing clinic?
I'm not briefed on that,
okay.
no.
And are all staff at both testing clinics and vaccination sites vaccinated?
I believe so, as frontline workers. Those who would be relevant would be vaccinated. I'm getting nods from behind me, so yes.
And how often are they tested?
I'm not certain.
Are they tested?
I'm not certain. I'm happy to come back to you. They wouldn't be tested as often as hotel quarantine, for instance. And they'd be tested when they were symptomatic, I think. But if there's sentinel stuff, we can come back to you on that.
Just on healthcare workers, sorry. Can I just follow on from that? Sorry.
Sure.
A staff member also from Footscray Hospital has tested positive to COVID-19.
Yes.
40 healthcare workers are now sent in quarantine. So how are we prepared to manage outbreaks in these types of
Yeah, it's very
settings?
challenging. The best way to manage COVID in your hospitals is to do everything you can to stop it getting into your hospital system. Like we know from last year, the number of staff that had to be furloughed. And therefore, because, look, we have more nurses than we've ever had, we have more ambos than we've ever had, the system has grown, it's bigger than it's ever been, right? But even on any given day, we don't have limitless numbers of people who can nurse someone who is on a machine to breathe and needs that one-on-one 24/7 nursing, right? They're not limitless. They're a precious thing. All of our staff are, but, you know, that's just by one example. If you suddenly have a bunch of people that have to be furloughed, then that means those who aren't furloughed have to work double shifts. And some of the stories that I heard last year, and it'll be happening in New South Wales as well, that's what's so desperately sad about what's happening up there. It's the deaths, yes. It's the costs of a lockdown, same as here. But the number of people in hospital, I know what those staff will be going through because I've had ones in our staff tell me those stories. So you've got to work as hard as you can to keep it out of your hospital system. That's the best thing to do. If it gets in, you do have a very broad brush though. We furlough in a very conservative way. It will disrupt services. So that's why we all have to work hard to follow the rules, get the case numbers down, get the vaccination numbers up. And that's, if for no other reason, if you honour the work that our health professionals do, our nurses and ambos and doctors, if you value that, if you think that's the best of work, then let's all of us contribute to them having less work to do, not more.
On that, sorry. So a lot of those workers now at the Western hospitals are in isolation, and they're frustrated because that does, as you mentioned,
it keeps them from what they're passionate about, which is treating their patients.
So, Premier, how do we strike the balance once it is in the healthcare systems? How do we strike that balance?
You've got to furlough according to well and truly understood protocols. The key point is, if you have more virus in the community, then it will get into our hospitals, because sick people go to places of care to get the care that they need. That just logic just tells you that. That's what happened last year. That's what's happening in New South Wales at the moment. You can't have 500, 600, 700 people in hospital. You can't have 10,000 cases and not have all of these knock-ons. It's just the way this virus works. And with Delta, everything's twice as fast, or we should assume it is. So on that basis, we've got to work really hard to keep it out of our health system. It's got in some limited circumstances in the last few weeks, but we're all working very hard to keep it out. And we thank all of our care team and cooks and cleaners and car park attendants and ward clerks and orderlies, everyone who does the work because healthcare is provided by teams of people. They're doing an amazing job, and they're doing it in unprecedented circumstances.
Have you spoken to Danielle Green?
I'll do the next question, because I think he's asked it 4 times now. No, I have no, I have not. No, I have not.
Does it smack of a double standard?
Well, her partner, her husband, is in the midst of a very, very long and painful and very difficult, you wouldn't call it a successful, cancer journey. And she's providing the best care that she can to him, and I don't think that anyone should begrudge anyone else doing that. She's followed the rules, that's the advice I have, and she intends to continue following the rules. I really can't offer any more than that, other than,
Can you explain how she's followed the rules?
None of us are special. Cancer is something that so many families live with and deal with, and she's doing the best thing by her husband, and she's doing it in circumstances that I think you wouldn't wish it on any family to have to deal with cancer like that. It's very challenging, very difficult. My advice is she's followed all the rules, and she's been very careful to do that. And she's now taken some time off to look after her husband.
There's been a lot of instances where people were unable to visit their families, even for compassionate reasons, people who are suffering from cancer.
Yes.
Is it not a slap in the face to those other families who are also going through very similar circumstances?
Well, I know there's... Let me explain by way of example. There has been a well-publicised case of someone from Sydney wanting to come to Melbourne for the best of reasons. Sadly, that's not possible, because Sydney poses a really significant risk. The risks we're talking about are not comparable. Like the word cancer is in both of those stories. It's tragic, but they're not comparable. The risks are not comparable. But in any event, I think I've answered that question. People are free to make their own judgments, of course, and I'm sure that they will. But my advice is that the rules have been followed, and she's been very careful to do that. And her husband is not well and is in the throes of what has been a very, very long cancer journey. And we wish him well, as we do every person who's doing it tough through that particular illness.
But today's cases, were any of them connected to the homeless people from St Kilda yesterday? And do you have any plans to reopen or actually really accelerate homelessness centres to allow people to, live safely?
I'm not certain on the first part of your question. Somebody can add, or later on we can confirm that for you. But in relation to homelessness services, so emergency accommodation to get rough sleepers and people who would be in public places, to get them off the streets, as it were. We've got, I think, something like 1,600 people that are currently still using and have taken us up on offers of emergency housing and accommodation in the context of the COVID pandemic. So that never stopped. That's been an ongoing thing, and we'll try and provide more permanent housing for each and every one of those people once we get beyond this. I can well recall around Christmas time, I was walking up Collins Street, and a woman came up to talk to me, and you're never quite certain whether it's going to be good news or bad news, but I sat there and listened, and she said that the program had saved her life. She had been homeless for a long period of time. She had taken us up on our offer to be put into a hotel. I think she's now in more permanent housing. So this program has worked. I want to thank the Lord Mayor and the City of Melbourne for their partnership in this. and as well as others. And you've heard us talk about homelessness a lot, invest a lot. Big build is an important part of that as well, the big housing build. And we've got specific arrangements, and they haven't stopped because the pandemic hasn't stopped.
I invite you to reflect on the fact that we're in 200 days in hard lockdown now.
I've reflected on this virus and the damage it's done and the tragedy of it every day for 18 months. And I'd again say Victorians will get through this because we know how to do this. We know that there is no choice, much as we'd like there to be. Every leader in the country, every person in our country is grappling with this Delta variant and what it poses. There's no other way. And if there was, just don't for a moment doubt, if there was another way, we would all choose it. We would all do something very different.
Speaking of another way, for example, aged care has been disproportionately affected. Obviously 200 days hard lockdown, but for longer than that, people in aged care haven't been able to see relatives and alike. Yep. They're obviously now pretty much all fully vaccinated, or at least first dose vaccinated. So is there anything we can do to ensure that their life returns back to normal now that the vaccination rate is up in that cohort?
We need to get the staff vaccinated as well, because we don't want those places to become a place where, yes, there's less serious illness, but the virus still spreads. We have to be careful with that. But we're always happy to look at all sorts of different changes, trying to ease where it's fair and safe and proportionate to do so. But ultimately, what we want to try and do is get these rules off. And the way to do that is to get vaccination up and get case numbers down. If we follow the rules and play our part, that's what we will achieve. I'm very confident of that. That's exactly what we will achieve.
But is it fair those older Victorians haven't been able to see their families for a disproportionate...
No, it's not fair. It's not fair at all. It's not fair at all. But sometimes you've got to do what's safe and what's tough. There's been so many difficult decisions, And look, as the Chief Health Officer said the other day, the way the virus is raging in New South Wales, you would have had death numbers as great as ours, perhaps greater. It is such a relief, I think, to so many people that this has got into aged care in New South Wales, but they've been vaccinated. We didn't have that last year. We didn't have those vaccines. Now we're working hard to vaccinate all of our staff in public sector aged care. We have more beds than any other state, about 5,000. We're well advanced there, and I'm sure the Commonwealth's working hard to get all that private sector workforce vaccinated too. And then maybe the rules can change.
And speaking about rules changing, even while we've still got cases bubbling along at this 13 out in the community, which has been relatively steady for the past week, is there any option that we can use to open schools while cases are still bubbling around at this number, despite I know how many kids are infected?
It's incredibly difficult to open up with Delta, even if it's a small number of cases. However, I would just make the point. Numbers of cases, as today's numbers show, numbers of cases are not the same as the stories that sit behind those numbers. Yes, there's 57 cases today, but the vast majority were tucked away, no risk to anybody. We want to see that continue. That's the system working as it should. In the meantime, if we want to have those options, all of those options and many, many more, then we have to find a way to deal with the fact that the playgrounds are closed. We have to find a way to deal with the fact that we can only go out for a couple of hours and that we can only go 5Ks from home. All these things are tough and challenging and difficult, but they work. And Victorians know this more than anybody because we went from 700 cases a day to 0. This is a different virus. The numbers are smaller, but the challenge is really significant. I get that, I understand that. I want us to get these numbers down very, very low so that we have options that that New South Wales don't have at the moment and that we won't have if numbers continue to grow.
So just to clarify on that one, so even suggestions about staggered start times or alternate days for kids, none of that matters so long as we have a couple of cases.
No, I'm not saying that at all. What I'm saying is that you always have more options the less cases. If you have fewer cases, you have more options. If we have fewer cases or hopefully no cases that are in the community during their infectious period, then we have many, many options, and we will be as creative as we possibly can be to get our kids back to school. There are schools that are open in Victoria today that their equivalents are not open in New South Wales. So we can do things differently. We can achieve different outcomes because we've got lower numbers. There are venues open in country Victoria today that are not open in country New South Wales because we've kept these numbers low. the further down we drive them, the more options we'll have.
But comparatively, we've had more than 100 days where homeschooling's been relevant here in Melbourne over the past 2 years. When does the concern about our kids potentially falling behind and maybe the mental health risk outweigh the COVID risk with numbers this low?
Yeah, but hang on. So just think this through. We send all the kids back to school, we open the schools. That's 1 million people moving back and forth, kids, teachers, staff, parents, enormous movement. That will mean that we have more and more virus in the community. If this gets away from you, and we've seen in Sydney it's not that hard for it to get fundamentally away from you, then we're not talking about the well-being of kids so much, or that, you know, whether this is easy or hard. That'll still be real, but that'll be sitting over here, and on this side we will literally have our intensive care units full. It's not a choice that I'm prepared to make, and every other Premier and the Prime Minister and every public health expert who thinks about this for, you know, any period of time, you don't want to get in. That's how binary Delta is. I wish it wasn't. You know, I profoundly wish this was not the case. And then we would be making different decisions, and the schools would be open. We'll give our kids as much certainty as we can, as soon as we can, particularly our senior school kids. I know it's tough for parents. I know it's tough for students and for teachers and staff. And if there was another way, that didn't mean that you were almost certain to have not hundreds of people in hospital, but thousands. And I again stress, not that anyone wants 90-year-olds passing away, but it's not just people who are at the end of their life. It's otherwise healthy people. It goes where the vaccine isn't. That's what's happening in so many parts of the world. And those cancer patients we talked about before, and stroke patients, and people who have terrible accidents that happen every day, strokes, the whole thing. There's no beds for them either, because the place is full of COVID patients. That's what we're trying to avoid.
Can I follow on from Mark's question just about Melburnians spending 200 days in isolation since the pandemic began?
Yep.
There are only 3 other cities worldwide that have endured more days in lockdown. So what's your message to Melburnians that are having to endure some of the toughest restrictions worldwide?
Have a look at the death rates in those cities. Have a look at how many funerals they've had in those cities and states. We've had a fair share, we've had too many, and that's heartbreaking. But, you know, we can have comparisons with London, we can have comparisons with all sorts of other cities around the world, and there really is no comparison, because we haven't had 50, 60, 70, 80,000 people die. We've made tough decisions. Politics has never been less relevant. It's not about being popular, it's about getting this job done. Victorians can do this again. I know they can, as hard as it is. We have an amazing, and I'd say a unique capacity, an unprecedented capacity to stick together, to work together, to look out for each other, and to be as stubborn as this virus. We have shown that. We will get these numbers down, and then we will get open again. And then we'll be able to go to the playground and have schools open again and resume the delivery of our jobs plan with all the benefits and all the positivity of that. Cases down, vaccination numbers up. That's how we get past this.
And can I ask why you've shut playgrounds and kept the Richmond Safe Injecting Room open?
Well, I don't think there's any comparison between injecting drug users. Would you prefer they died in alleyways? That's what they used to do before we had a safe injecting facility. Well, they did, literally. They died in gutters. My position on this is very well known. It's a health measure, and it'll remain there providing care in a COVID-safe way as best you can, like every other hospital and every other health service, because the alternative is that we go back to the days where, I know I've reminded you of this before, and maybe I should just stop there, but I can't but remind you again. The day I announced it, a person OD'd about 30 yards from where I was announcing it, and paramedics had to rush to save that person's life. It's a real issue. We've got to try and do everything we can to avoid that.
And do we have any update on the Urella building? Obviously.
No, I have no announcements to make about supervised injecting facilities today, other than the pretty clear comments I've just given you in answer to your question. You all want your own?
Yes, please.
Thank heaven for that.
Professor,
No problem. Jerome, come on down.
can we have Professor Cowie after that as well, please?
Of course.
Jerome, can I just ask you,
Judy.
the St Kilda East cases, the three of them, were they all at that engagement party?
Look, they were certainly part of the social contacts of the St Kilda East cluster. So we have connected them to the 7 cases we had there yesterday. So they are part of that wider cluster. I think there were different social contacts that were made. I won't go into the details, but we're pleased to have identified them. Pleased they're cooperating with the contact tracing, and we'll work with them to keep them and the community safe.
So social contacts, was there another event that they interacted
Look,
at?
my understanding is there are a number of contacts, both that people would normally make. There have been some other contacts that we'll continue to work on, but the most important thing is we have a number of cases. We have linked those cases. The community has been very supportive. We're getting good information, and that helps us to keep them safe and to keep the rest of the community
How many
safe.
people were self-isolating now in that outbreak?
I would need to come back to you with those numbers. It'll be in the region of around 120, 130 people are now in that outbreak who are isolating as primary close contacts.
Are you aware?
Sorry, Jim, one more.
Are we done with the big batch of day 13 tests? Do we expect to see the numbers back in the 20s?
Yeah, no. Sorry, go on.
Or can we expect high numbers again tomorrow because we have more day 13 tests?
Yeah, so we have another big day today of day 13 testing. So you recall 2 weeks ago we had the significant outbreak at Altacpur College. We had a number of other big schools in that outbreak as well. So there'll be big days of day 13 testing today and tomorrow. I haven't seen our emerging numbers yet this morning, but I will expect there to be a number of cases again tomorrow, and we'll work through those as we normally do. Nick.
Regarding Steph's question earlier,
Yeah.
can you tell us what has happened at that Paran, I think it's either a testing centre or the town hall, where we're told someone has tested positive?
Yeah, look, I've heard some media reports this morning. I haven't got any confirmed information around a possible case in that space yet. If that information comes through, we'll pick it up as we normally do.
And the Footscray Hospital, what can you tell us anything more about the situation at Footscray?
Yeah, look, so this is a positive case that we identified yesterday, I believe, in yesterday's numbers. So it's a member of staff who works at Footscray Hospital, and as normal, Western Health implemented its normal COVID-safe plan. So 14 other staff have been furloughed, people who had contact with that positive case individual, and it's part of the narrative we've seen over the last 2 weeks. Yeah, we've had up to, I think, 350 or so Western Health staff who've been furloughed, either as people who've been to exposure sites because they're parents of children at some of the schools that we've been working with, or because they've come in direct contact with a positive case. This is part of the protocols and arrangements we have in place in all of our health services to ultimately keep COVID out of our health services. But it also shows the risk to the health system when we have COVID, community transmission in the community. This is why we want to keep COVID out. When you see this community transmission, particularly health services, but other critical services can all get exposed through people going about their day-to-day jobs.
Jerome, how many children?
That worker worked in the medical imaging department. Were they vaccinated?
I don't know. I don't have the status in front of me.
And how often are staff at vaccination and testing clinics tested? The Premier didn't know. Do you?
Yeah. So look, all of our health service staff who make up the bulk of our vaccination and testing staff, are required to go through those vaccination protocols. High levels of vaccination across them all, well over 90%. There is an ongoing testing protocol with those staff. It is not as frequent as we do with our hotel quarantine system, but we encourage all of our staff, any symptoms whatsoever, please come forward and get tested. The different centres have slightly different arrangements, also depending on the level of COVID status in the community.
What's the process of Sunshine West being told to close? Are you aware?
No.
Jerome, are there any children?
Sorry.
Are there any children in hospital?
My understanding on the basis of the numbers that Ben read out this morning, so we've got 14 cases in hospital at this point in time. I don't think any of those are children. Certainly yesterday's number, there were no children in. I don't think that's changed.
What's the risk profile of the kindergarten teacher who's refused to be tested? What was her level of contact with a COVID positive case?
So we're working with the kindergarten at the moment around establishing the full assessment of all the primary close contacts who've been exposed there. It is at this point in time a Tier 1 exposure site, and look, as we always do, particularly with a high number of children we've had involved in these outbreaks over the last couple of weeks. That will continue to be a Tier 1 exposure site for the moment. We're working with a number of staff individuals around understanding their contacts and their testing status.
And of today's cases, were any a part of the homeless community? of today's cases were any part of the homeless community?
No. So we've no cases at all. So positive developments yesterday. We did a lot of testing around some of the rooming houses and hostels, particularly in the Little Grey Street area. All those tests so far have come back negative, which is a really encouraging sign. Again, my thanks to the many social agencies, partners and vulnerable people in that part of our city for their cooperation. They're being well supported, will continue to be so over the next few days.
Those 13 cases that have been out in the community, are we anticipating a lot of exposure sites, or was it just one day before they were isolating?
No, and as I went through earlier, Julia, so we've got 10 people who have come up for that contact tracing process. They are all exposed partway through their infectious period, but the vast majority have been in isolation for a number of days already. Of course, the 3 mystery cases we're dealing with today are always a bit of a mystery, hence the name. So we'll do some work with that today and tomorrow to establish their full links. But this is also the importance of lockdown, and what we've seen over the last week is that increasingly the cases we are picking up have got far fewer movements because the vast majority of us are being asked to stay at home, only go out for 5 reasons, and that's why that's so important. So although we never want to see mystery cases, we pick them up now. There should be far fewer contact sites and exposure sites and fewer links for us to work through.
Sorry, I forgot the name of it. The Manhattan high-rise apartment in the CBD is apparently caught up. What's the link there?
Yeah, so we've got a positive case who's been in that building. I don't think they live in that building, but they've been in that building. We're currently regarding it as a Tier 2 site. We'll do the full testing protocols as we normally do.
Certain floors Tier 1, or are they just
not at this time? Obviously, we'll continue to investigate exactly what the exposure's been.
And the Premier mentioned that you've got evidence of outdoor transmission today. When I checked with your department yesterday, they said there were no confirmed cases despite of outdoor transmission just yet. Has anything changed, or are we still at 0 confirmed cases of outdoor transmission?
No, my understanding is I talked to this yesterday in the press conference. There was a case of between a Glenroy student and another school student. I believe that's a case of outdoor transmission, but happy to get the team to come back to you on that.
Do you have an update on the playground transmission? The question I asked the Premier before.
No, I went through yesterday. Same answers yesterday. Run the tape.
Can you give us a breakdown of what the investigation is, where that playground is?
I went through all this yesterday.
I don't think you mentioned where the playground was.
No, but there are two playgrounds listed as Tier 2 sites.
2 cases of Legionnaire's disease have been detected in the Cranbourne East area, and symptoms are similar to COVID. So how concerning is this, and how do people distinguish the difference between the two?
Sounds like an acting Chief Health Officer question to me. I might hand you over to Ben. Ben, thank you.
Thank you. So I believe the question was about the symptoms of Legionnaire's disease relative to COVID-19 and how can people tell the difference?
Correct, now that there's been an outbreak,
Yeah, indeed. So 2 cases in that area, Cranbourne East, I believe. And so obviously the public health teams are working through to find sort of the potential source. Legionella can be a very serious condition indeed. We go through a protocol looking at exposure sites, looking at cooling towers and there's a surveillance system in place for cooling towers. To your question about the symptoms, they can actually be quite similar in the early stages of the illness. So things like shortness of breath, headache, fevers, fatigue are quite common to both. So certainly, I guess one message to our clinicians out there is obviously if someone's presenting with symptoms that could be consistent with COVID, they absolutely must be tested and treated on the basis that they could have COVID as a suspected COVID case. But we do need to obviously draw the net wider and think about other causes. Our clinicians do that every day. And particularly at the moment, doing testing for Legionella would be very, very wise if someone's presenting with those symptoms. Legionella can be a life-threatening condition, and it is something that we really do need to start. There's very effective treatments available, antibiotic treatments for Legionnaire's disease. So we would certainly advise clinicians, patients, if they've got concerns, come forward, get tested and get worked up.
Has it been prominent in the community as of recent times? Or is
No, I mean, look, the number of cases of Legionnaire's disease or Legionella are a lot less frequent. That's partly for the same reason that influenza is less frequent and a lot of the other respiratory illnesses, because people are just not moving around to the same degree. Obviously people aren't attending workplaces to the same degree. But it is certainly something we've got to keep an eye on, and the public health teams are swinging to action around that.
Yesterday the advice was for anyone in the St Kilda area to get tested regardless of symptoms, and it's the same advice for the industrial zone in Sunshine West.
Correct.
If people don't have symptoms and either live or work in those areas, do they have to isolate after getting tested? Or?
Yeah, so the advice is that yes, if we're looking at testing as part of an outbreak response, in this case in the St Kilda area, as was mentioned previously and Jerome spoke to yesterday, and indeed in the setting of Sunshine West, this industrial precinct that I referred to earlier, then yes, people would require isolation. I guess the reassuring point there is that our testing system is functioning at such a high level that 91% of those tests come back within 24 hours and 99% by the end of the next day. So that period of isolation is important for public health reasons, but shouldn't be too long if the test is negative.
Last year we were able to crush the second wave of COVID despite having, at the peak 700 cases a day.
Yes.
Given the situation in New South Wales where the virus is raging, we're dealing with Delta, which is far more contagious than what we were dealing with last year. Realistically, is it possible to get to zero again this time?
Well, that's the objective, and as the Premier mentioned, that's the...
Is it possible?
Yes, it's absolutely possible. Can I just reflect for a moment? At this point of the second wave of COVID in Melbourne, there were over 2,000 active cases of COVID-19 at this point along the epidemic course. And a week later, there was over 4,000. What we are doing right now is working. We've got 295 active cases. So it's a very clear perception people may have to say, well, why are we in lockdown when there are so few cases? Let's flip that on its head. It's because we are in lockdown that there are so few cases. And all the measures that have been referred to, people isolating, and my heart goes out to those people who have had positive day 13 tests, as the Premier referred to. Their sacrifice is keeping us all safe, and my heart goes out to them having to extend their isolation period by that long.
Sorry, just to confirm, I've received some information from people in the Caulfield North area that are getting asymptomatic testing that they don't need to isolate. Do they have to isolate until they get that negative result?
So just coming back to the point, and I will make it clear because I understand this is a little confusing. People might receive slightly different messaging. Sometimes our messaging changes as we get the understanding of the extent of an outbreak. So it could well be that some early advice has been supplanted. Let me say that for people who are being tested in the St Kilda area and for people I've just referred to who are working in that Sunshine West industrial area, if you are being tested asymptomatically, yes, you do need to isolate until you get the results of that negative test. The reason for that is we are trying to get ahead of an outbreak, and as Jerome referred to, we have unlinked cases still popping up. So this is an outbreak response, therefore, yes, if you are asymptomatic and tested in the St Kilda area or in that Sunshine West industrial area, you need to isolate until you get a negative test.
You've called out wastewater detection in the Shepparton area.
Yes.
Shepparton has a very high Indigenous population. Federal government data from a couple of weeks ago showed low vaccination rates there. How can we improve? Has it improved since then? And how can we continue to improve vaccination in an area like Shepparton?
So I actually think many parts of regional Victoria have relatively high vaccination rates, and particularly when we talk about the Aboriginal and Torres Strait Islander community in Victoria has the highest levels of coverage of anywhere in the nation for Indigenous people. That is testament to the strength of the community. It's testament to the amazing work being done by our Aboriginal community-controlled health organisations who have been on the absolute forefront of vaccination and messaging for their community. And so I would basically say, yes, we always want to do better. We need to do everything we possibly can. But in Victoria, the Aboriginal and Torres Strait Islander communities have higher levels of vaccination than do non-Indigenous people. What an amazing achievement by that community.
People getting a day 13 test, do they have to go out to a testing site and get tested, or does someone come to them? Because there's some concern we're seeing so many positive cases that people might catch it in the testing queue?
Yeah, so look, absolutely. The testing is all done, obviously, with the highest levels of biosecurity, infection prevention control. We are talking about thousands and thousands of people. As Jerome mentioned previously, I think 3,000 primary close contacts were cleared just yesterday. So all of those people would have undergone a day 13 and test and received a negative result. So yes, they are going to testing sites to be tested for the vast majority of those individuals. Where there is geographic areas of focus, we're obviously setting up additional testing sites so that they don't have to travel too far, and the testing is done with the highest levels of safety.
Sorry, is the police commissioner still here?
Yeah, can I?
Sorry, this is the last one from
Okay,
me.
one more, sorry.
Last one from me. Do you think one unconfirmed but possible transmission event in a playground is solid enough for a Melbourne-wide ban?
So, look, again, I think this has been discussed by the Premier, it's been discussed by Brett and Jerome previously. Can I just add the same point? We don't want to have to do this. This has got significant welfare implications, social and mental health implications, no question. When we are looking at public health responses, we have to be proportionate, totally agree. The flip side is, as the Premier referred to, I think it is 45% of all our current active cases are people aged under 19 years. Right now, right here in Victoria. So yes, children are at risk of the Delta variant of COVID. We have seen transmission outside, picking up on what Jerome said previously. We have seen outdoor transmission between children. So while we continue to build evidence and we continue to learn about the Delta variant and its transmission capacity, I think it is proportionate to try to mitigate any potential risk to children and to families. And again, picking up on the Premier's point earlier, it's not just about what the children are doing in the playground. It's about all of the gathering of other individuals around those children, the need to ensure that they're not being exposed to COVID and transmitting and taking it back to their families and so on and so forth. So yes, I do believe it's a proportionate thing to do, as hard as it is.
And does the COVID test pick up Legionnaires?
No, absolutely not. The COVID test only actually picks up COVID, not even other types of respiratory viruses. The test for Legionnaire's disease is actually, the initial test is actually a test on someone's urinary antigen test. GPs are really, really aware of that. So again, if there's a suspicion of another cause or if someone's COVID test comes back negative and they're deteriorating, exploration of all of the other potential causes, including Legionnaire's, would be important.
Sorry, just a question for the Chief Commissioner. Thank you. Those 4 people that were fined for the Caulfield North engagement party, is that the $5,500 fine?
Yeah, $5,452.
And investigations are continuing to confirm there's a likelihood that more people will be fined because of that event?
Oh yeah, the expectation is that every person who was present at that party will be interviewed unless there's an exemption that applies that they would receive infringements.
And for Chief Commissioner, are you planning for a potential protest this weekend? I understand there's plans for nationwide protests on Saturday. Is police prepared for that?
Yeah, we've received some advice that there's some so-called freedom rally or similar being proposed for Saturday around midday. And we're obviously doing what we normally do in gathering our intelligence. There seems to be numbers at this stage indicated between 500 and 1,000 people. I would obviously urge everyone, do not attend. If you do attend, you're breaking the law and we will hold you to account. It's as simple as that.
Are you going to set up the so-called ring of steel around the city to stop people coming in?
Look, I won't reveal what tactics we're going to do, but we will be, engaging in a range of different tactics to make sure people don't get into the city, and those that do get into the city, that they are dealt with very quickly. They can't come in. Protesting is not allowed, and obviously it's a significant issue for us. We'll do everything we can to stop them holding that protest.
Just a question on business support. The Federal Treasurer has just announced an additional $807 million in partnership with the Victorian Government for small and medium businesses.
Yep.
Do you have any further information on that package?
I'm going to leave it to Minister Pakula to update you on, he can answer all your questions in relation to that package, but the key point here is that it's, again, our government and the federal government working together to provide support. The vast majority of that will be paid out as the previous grants have been paid out in like an auto pay, so no need to fill in forms. And any questions you've got around that, I'm sure Martin can speak to.
And will that be today or tomorrow?
That'll be, I think, today.
Okay.
Today. There's media releases gone out, but there'll be other opportunities. This media conference has gone so long that I will need to get updated about when Martin's coming out and what form his briefing will take.
One non-COVID question. The Infrastructure Victoria today has recommended phasing out of rego and phasing in of a usage charge. Does your government support that?
No, my views on those matters are well known. We're not tolling existing roads. We've been very clear about that. And the only way to go to that sort of a system is to do exactly what we said we won't do. We value the work of Infrastructure Victoria. I think we're close to getting on with about 90% of the things they put forward, but they're not the government. They're there to provide advice and different ideas, and we're also entitled to lay out our plans. We're building the projects Victorians voted for, and we've been very clear in relation to those sorts of charges. We want to build not just better roads, but a better public transport system as well. And there'll be some quite exciting announcements to that end in the coming weeks and months as well.
We understand that some refugees from Afghanistan may be flying into Melbourne as early as next week. Are you across that?
We have I've committed personally to the Prime Minister, and we've exchanged letters, and we will play our part in helping to quarantine those who are fleeing the terrible scenes in Kabul and in other parts of Afghanistan as well. To Melbourne and Victoria's proud Afghani community, I want to say how our heart breaks to see what's happening there. This will be a very, very challenging time, and not just for the Afghan community, but for many other communities who came to Australia in similar circumstances. I know this will be very challenging, whether it be people of a Cambodian background, people of a Vietnamese background, and indeed others. The other thing too is I spoke with His Excellency the Governor-General yesterday, just as he often calls, just to check how things are going, and obviously as a former CDF and Head of Army, I made the point to him that our veteran community in what was our longest war will be feeling, this will be a very challenging time for them as well, very challenging. So we're going to play our part. There'll be a number of those people who we've got out safely, who will do their hotel quarantine here, and we've got more to say about that. I'm very conscious that that's a live thing, and we don't want to say or do anything that might compromise the safety of anybody, but we have been asked to play a part, and we absolutely will.
Do you have a rough number as to how many?
I won't do a rough number now because I'm not authorised to do that, but we've been asked, and we're doing everything that's been asked of us, but we send our best wishes to the Afghan community here in Melbourne and Victoria, and the best wishes to any other community for whom this kind of experience will be, it will remind them and bring back for them some really traumatic times. And of course, our best wishes to all of our veterans who served so bravely in the defence of our freedom in that theatre and in so many others. Any other issues? If not, thank you so much. We'll see you again soon.
Thank you.
Thank you.
Yeah, it was plural again today.
Just, which one? That one. Yeah, sorry, it's just clicked.